So question here, the nurse note the patient care assistant looking through the personal items of the client with a cancer. Which action should take by the registered nurse? A. Notify the police department as a robbery. B. Report his behavior to the charge nurse. And C. Monitor the situations and note whether any items are missing. And D. Ignore the situation until items are reported missing. So out of 4, what should take action by registered nurse? So the answer is report this behavior to the charge nurse or team leader or manager. So the best action at this time is to report the incidents to the charge nurse or team leader or nurse manager. So further action might be needed, but it will be done by the charge nurse. So answer A, C, and D are incorrect because notifying the police is overacting at this time, and monitoring or ignoring the situation is an inadequate response. What else? Which client can best be assigned the newly licensed nurse? So out of 4 patients who is stable, it is good to go, tell the new licensed nurse to take care of them. Number A, the client receiving chemotherapy. B, the client post coronary bypass. Number C, the client with a TURP, means transurethral resection prostate. This is the surgical operation of the prostate gland. And D, the client with a diverticulitis. Out of 4 patients, who is more stable? Answer is D, right? Who have a diverticulitis. The best client to assign to the newly licensed nurse is the most stable client. In this case, it is the client with the diverticulitis. The client receiving chemotherapy and the client with the coronary bypass graft both need the nurses who is very experienced, right? Because chemotherapy patients have a chance to develop side effect, and coronary bypass also they need a skill hand. So the answer A and answer B are incorrect. What else? Answer C. Answer C is incorrect because the client with a TURP, means transurethral prostatectomy, might bleed. So this client should be assigned to a nurse who knows how much bleeding is within the normal limit, right? So the newly licensed nurse will not able to measure it. What else? The nurse has an order for medication to be administered intrathecally. So this is the one route of medication administration. The nurse is aware that medication will be administered by which method. So here we go. Number A, intravenous. Number B, rectally. Number C, intramuscular. And number D, into the cerebrospinal fluid. So intravenous, definitely the medication through the vein system. Rectally means medication inserted through the rectum or anal canal or anus. Intramuscular means injection through the muscle. So the correct answer here, what is intrathecally? It is into the cerebrospinal fluid or CSF. Answer is D. So intrathecal medication are administered into cerebrospinal fluid. This method of administering medication is received for the client metastasis, the client with chronic pain, or the client with a cerebrospinal infection. The answer A means intravenous, answer B rectal, or answer C intramuscular are incorrect because intravenous, rectal, or intramuscular injection are entirely different procedure. It is not intrathecal. Next, the client is administered to the unit after cholecystectomy, means it is the surgical operation in gallbladder. When the stone formation in the gallbladder we call polylithiasis. So Montgomery strip are utilized with this client. The nurse is aware about these strips are utilized on this client. Why? Number A, the client is at the risk for evisceration. Number B, the client would require frequent dressing change. Number C, the strip provides support for drains that are inserted into the incision. And D, no suture or clips are used to secure the incision. So the correct answer is B. The client will require frequent dressing changes. So the Montgomery strips are used to secure the dressing that is required the frequent dressing changes, because the client with a cholecystectomy usually has a large amount of drainage on the dressing. So this strip are also used for the client who are allergic to several type of tape. So this client is not at the higher risk of evisceration than the other client. So answer A is incorrect. And Montgomery strips are not used to secure the drainage. So answer C is not correct. And suture or clips are used to secure the wound of the client who has had gallbladder surgery. So answer D is incorrect. So a client with a pancreatitis has been transferred to the intensive care unit. Which order would the nurse anticipate? What next? Number A, blood pressure every 15 minutes, insertion a Levine tube, and C, cardiac monitoring, and D, dressing change in 2 times per day. So the client with a pancreatitis, the correct answer is number B. The client with pancreatitis means inflammation of the pancreas frequently has a nausea and vomiting. So lavage is often used to decompress the stomach and rest of the bowel. So the insertion of a Levine tube should be anticipated. So answer B is correct. Answer A or answer C means blood pressure or cardiac monitoring are incorrect because blood pressure are not required every 15 minutes or cardiac monitoring might be needed. But this is individualized to the client. Answer D is incorrect because there are no dressing to change on this client, right? Pancreatitis. What else? The nurse is caring for a client with a diagnosis of hepatitis, right? Who is experiencing pruritus or pruritus. So hepatitis means inflammation of the liver, or hepatocyte we call liver cell does not work. When liver cell does not work, bilirubin is gathered or accumulate, and bilirubin when gathered, it is accumulate over the skin and cause itchy or pruritus. Which would be the most appropriate nursing intervention? A, suggest that the client take the warm shower in 2 times per day. B, add the baby well to the client bath water. And C, apply the powder to the client's skin. And D, suggest a hot water rinse after bathing. So what is the correct answer? So correct answer is add the baby well to the client bath water. Answer B. So the baby well can be applied to help with the dry skin and to decrease the itching or pruritus. So adding baby oil to the bath water is smoothing the skin. So answer B is correct. Answer A is incorrect because 2 baths per day is too frequent and can cause more dryness. Answer C is incorrect because powder is also make the skin dry. Raising with the hot water suggests the hot water raise. A started the answer D, dry out the skin as well, so it is not an answer. Next is the nurse recognized that which of the following would be the most appropriate to wear when providing direct care to the client with a cough. Number A, masks, big ground, gloves, and also the shoe cover. So which is the correct answer? The correct answer is the wear the mask, right? So if the nurse is exposed to the client with a cough, the best item to wear is a must. If the answer had included a mask or gloves and a gown, all would be appropriate. But in this case, only one item is listed. Therefore, answer B, answer C incorrect, and shoe cover are not necessary. So answer D is incorrect. What next? A client visit the clinic after death of the parent. The client visit the clinic after the death of the parent. Which statement made by the client's sister signify abnormal grievings? Number A, my sister still have episode of crying and it has been 3 months since daddy died. Here, number B, Sally seems to have forgotten bad things that daddy did in his lifetime. And see, she really had a hard time after daddy's funeral. And she said that she had a sense of longings. And number D, she has not been saddened at all by daddy's death. And she acted like nothing has happened. So what are the correct answers? So which statement made the client's sister significantly abnormal grievings? So the correct answer is number D, right? So here, this is the correct answer. This is the correct answer. Why it is correct? So abnormal grievings is exhibited by lack of feeling sad. If the client's sister appears not to grieve, it might be abnormal grieving. So she thinks the client might be, stoppage the feelings of grief. Number D, reflect it. Answer A, answer B, or C are all normal expressions of grief, and therefore it is incorrect. What else? So the nurse is obtaining a history of 80 years old client, right? So 80 years old client is the keyword. Which statement made by the client might indicate potential fluid and electrolyte imbalance? This question is very high yield for NCLEX board. A, say my skin is always so dry. B, say I often use laxatives. C, I have always liked to drink a lot of iced tea. And number D, I sometimes have a problem with the dribbling urine. So they said, which statement by the client might indicate potential of the fluid and electrolyte imbalance, right? Definitely answer is number B, I often use laxatives. This is the answer. Why? Because frequent use of laxatives can lead to diarrhea and electrolyte loss. So when patient have a diarrhea means it lead to fluid loss. Fluid loss means electrolyte loss. So answer A, the skin is always dry. C, I mean, always like to drink a lot of tea, iced tea, or D are not a particular significant in this case, therefore are incorrect. So what next? So the client is admitted to the acute care unit, right? And initial laboratory values revealed serum sodium level 170 milliequivalent per liter. What behavioral change would be the most common for this client? So a patient in the acute care unit, you check the serum electrolyte and you found sodium level is 170. So what behavioral change would be the most common for this client, right? They say A, anger, B, mania, and C, depression, and D, psychosis. So if my sodium level is more than normal, which should be the common behavior or most common for the client, right? So the correct answer, patient should be manic, or patient should have the mania. So the client with serum sodium 170 milliequivalent per liter has a hypernatremia. Sodium going up, we call hypernatremia, and might exhibit the manic behavior, we call mania, hyperactivities. So answer A, answer C, or D are associated with hyper, sorry, I said A, anger, depression, or psychosis are not associated with hypernatremia, therefore are incorrect.